Medical groups say untreated chronic wounds are costing the Australian health system $3 billion a year. Around Australia, there are 420,000 people living with chronic wounds, with those living outside the big cities, poorer people and First Nations people the worst affected. Hayley Ryan is chair of advocacy group Wounds Australia, and she joins us now. Hayley, welcome. So when we're talking about chronic wounds, can you give us some examples and what's the care that's needed for these wounds?
So the problem is people don't realise how bad wounds can get. We're not just talking about if you've had a fall, you've got a little scratch on your knee and put a dressing on it. These wounds, if they progress to get worse, then they don't resolve in 4 weeks. That's when they're a chronic wound. They can lead to amputation and even death.
And what's the kind of care that should be being given to these people that's not getting through?
Early referral and good guidance by a wound clinician. And so what tends to happen is they bump from GP to GP to GP, and they're not getting that real treatment at the right time by the right person.
And what are some specific examples that you've come across?
Well, I have a beautiful 28-year-old young girl at the moment. She has 3 beautiful children. She was bitten by a redback spider about 8 years ago now, and she's had this terrible wound on her arm, and she's still breastfeeding. So it's really impacted her life. She's been in my care for about 12 weeks, and we're almost healed that wound.
Well, and in what part of Australia was that?
So that's regional Victoria.
Yep. And it is people in the regions that, among other groups, that are worst affected by this?
Well, I would say there's different cohorts, right?
Yeah.
So there's over 65-year-olds that are definitely suffering, but also younger people. But yes, rural and remote is a real issue. So that's why telehealth services are absolutely crucial.
And so, yeah, what are some of the solutions to this?
So look, we've got our 11-point plan with Wounds Australia. We're partnering with government bodies now to really drive that, and that looks at how we provide education and training to clinicians to build capacity and grow knowledge, but also look at reforms. How do we get subsidies for dressing products, for example? Some people are paying up to $1,000 a week for dressing products.
And how optimistic are you that the government will listen to you on this?
Well, I think we stay optimistic and we keep talking to them and we try to keep pushing for reform, because at the end of the day, you mentioned 420,000 people are living with wounds that we know of. We expect it to be a lot higher.
And how did you come up with this figure that it's costing like $3 billion a year?
Yeah, it's been studied. We've got the evidence. It's in the literature. We would actually say it's probably a lot higher, but because we don't have the statistics about how many people are actually living with wounds, that's only a very conservative estimate.
And so if there are people out there now listening to this and they're hearing you and thinking, oh yeah, I've had this issue for quite some time, I'm not sure that it's being handled adequately, where can they go?
Please go to the Wounds Australia website, seek out some wound specialists who are going to get you on the right journey and the right treatment plan.
Okay, Hayley, thanks so much for coming in and
Thank you.
having a chat to us.
Thanks.